All right, hello everyone, and welcome to the Babies in Common videocast and podcast. We are here today talking about positive cesarean experience, and Melissa will say more about that in a minute. I'm Jeanette Massey from the owner of Babies in Common, and I'm an internationally board certified lactation consultant, childbirth educator, mostly retired birth doula, and mother of 2 teenagers. Melissa?
And I am Melissa Ann Dubois. I am a registered nurse, childbirth educator, and lactation counselor. I've worked in all sorts of hospital and office OBGYN settings. I'm currently providing postpartum home visits for clients who have had home births and doing some birth doula work for couples that are planning hospital births during the COVID-19 pandemic. I'm also the mom of 3 small children.
Awesome. We have a great episode for you today, continuing from our part 1, episode 11. We're going on to part 2 today. And as always, anything that us or our guests or any participants say during this conversation shouldn't be taken as medical advice. Please consult your own qualified healthcare professional for questions about you or your baby's health. The opinions expressed during this conversation are personal to the host, guests, and any participants, and don't ever represent the views or policies of any current or former employer, including hospitals or clinicians. Our conversations are recorded on a HIPAA-compliant platform, and for a full review of our disclaimer, please visit babiesincommon.com/disclaimer.
Awesome. Thanks, Jeanette. So welcome back, Kate. If you listened to part 1, episode 11, you know that Kate Damon is a certified nurse midwife who works as a full scope midwife and attends patients in the office and catches babies for a hospital in Cambridge. And so if you haven't already listened to that episode, please do, because we learned in that episode that Kate got pregnant with her first baby in 2015, and that baby was persistently breech despite many, many attempts to get her to turn. And we talked all about all the steps that Kate took to try to get that baby to turn. And when we left off, Kate was considering, possibly having a vaginal breech delivery. So that's where we're going to start. Welcome back, Kate. So version number 2 doesn't work. How is that feeling? Like, how are you feeling about that?
Yeah. I definitely was discouraged. But at that point, and we touched on this in the last episode, I had transferred to a very respected, very experienced provider at the hospital I worked at, who is trained and skilled and experienced in doing vaginal breech births. And so I was trying to keep an open mind, trying to prepare for labor, trying to just approach it just as any full-term woman or full-term birthing parent does, thinking, I don't know what to expect. I don't know what kind of labor I'm going to have. I don't know what the outcomes will be, but I'm just trying to optimize things at this point and keep an open mind and be ready with the things that I can be ready with. So
what happened? I'm on the edge of my seat.
Yeah. So I was, I will also say, I tried to surround myself with positive stuff, right? So I remembered from my initial OB visit when the first midwife had done a pelvic exam. We don't do a lot of pelvimetry and measuring the pelvis and da-da-da, but she felt, and she was like, ooh, good, roomy pelvis. And I was like, thank you. And so I just kept remembering, yeah, I've got a pelvis you can drive a bus through. Let's just do this. But anyway, so I waited for labor, which did not come, despite me doing some things to try to nudge labor along. The story's a little more twisty and turny than this, but long story short, at 41 weeks, so 1 week past my due date, I had an ultrasound showing that I had low amniotic fluid, which indicates the placenta is sort of reaching its expiration date, so to speak. And so in patients who are eligible for an induction, we would typically recommend inducing at that point. But all of us, meaning the OB I was seeing, the whole department, my husband and I as well, felt we didn't want to induce a breech baby. So I never had a single contraction with that pregnancy. I had eaten lunch right before my ultrasound. So we made a plan to come back to the hospital about 8 hours later for a planned cesarean. So my husband and I went home for what we thought would be a relaxing afternoon. We thought maybe, we'd have a nap, do some last minute prep, take a shower with HIPAA cleanse, etc. But unfortunately, when we got home, our condo smelled like smoke and our furnace was malfunctioning. So, so we dealt with that instead. And then we went that evening for the C-section.
Oh man! Well, Murphy's Law, right?
Yeah.
Exciting day all around.
Before I said, I think my husband is the most gifted researcher, but I think my father is the most gifted person mechanically. Like, he can fix anything. And so he came the next day when I was like post-op day 1 or half, and he fixed got everything fixed while we were in the hospital. So I felt very supported, and like everyone brought their skill set to my birth and it was amazing.
Awesome.
Yeah.
So the title of this episode is Cesarean Birth Positive. And as we've learned by talking to you, this was not the birth that you were hoping for. You tried very hard to avoid, even so far as to plan for a possible vaginal breech delivery. Mm-hmm. So how was your C-section experience?
Right. So, I would say it was positive. I feel really lucky that everything went smoothly and that so many things were optimized for me. It really was positive. However, I don't want to minimize the fact that it was also difficult. So I think it's fair to hold both of those things at the same time. And I think it's only fair to acknowledge that it was also really challenging. So maybe I'll first speak to some of the challenges and then speak to some of the positives. It was challenging both physically and emotionally for both me and my husband. And I think probably even more so because it was our first child. And there were so many adjustments that had to happen. Just our own learning curve about, having a baby and how our whole way of doing things, our whole life was just different with a baby. And so I think the thing that caught me most by surprise was how my limited mobility affected me emotionally. So our daughter was born at 10:01 p.m. after a mildly intense day. I told you, the furnace and there's just like a lot to wrap our heads around in one day. Like, okay, we're, low fluid, we're doing this, we're doing lots of phone calls. You run to CVS and get the HIPAA cleanse. Oh, where's this smoke coming from? So we were tired, but more rested than someone who had been in hard labor all day, without question. Mm. And I think I pretty much knew that I would be up most of the night with her, but I hadn't realized that I would need my husband to do like everything for me. And that was a difficult adjustment for me. So, immediately post-op after a cesarean birth, you really cannot move much. I wanted to, but between pain and just the core muscles not being ready for it, you cannot move. So I think, again, I'm surprised by how much this jarred me. But basically, until that very moment, my husband and I had always had a very equitable relationship. We both worked full time, we were busy, we had a really strong relationship, thank goodness we had that to fall back on. And we had a lot of independence within our relationship. And I was, a strong, independent person who just kind of, did what I wanted to do. And, I think if one of us was sick or really busy or something, then of course the other one would help out with some extra stuff. But largely, we just both took care of our own basic needs, of course. And it was just like, boom, all of a sudden, I felt like I spent that whole first night just bossing him around like he was my servant. And I didn't like it, but we didn't really see a way around it. So in the early hours, if I wanted to adjust myself in bed, I needed help doing that. And if I was thirsty, I couldn't just get a drink of water. I needed to tell him and have him go fill the water and then move the tray close enough to me that I could reach the water bottle. But there's so many things you need to reach. I would still be like, oh, now can you pass me my phone? Now can you pass me? There was just always something out of my reach and I could not reach it. Or if our daughter cried, and she was also a very intense newborn and she cried a lot and she had a lot of needs, he would need to pick her up and hand her to me. And then I would need that pillow, no, actually that towel rolled up, no, this, that, to get things comfortable, because breastfeeding after cesarean is also a little trickier and you have, more more pain, and you need to sort of adjust the positions that you're using. And so sometimes I would need him to reposition our daughter. And then, in those early days, if she needed a new diaper, that was him. I was certainly not getting up out of bed to change a diaper. And it was just constant. So we talked about it then, and of course he wanted to do it. Thank goodness, I feel lucky that I had a really supportive partner. But of course it was also exhausting, and I just felt like no one got a break. And I remember I would make decisions that were sort of like, I would deny myself something. I'd be like, oh, my lips are just like so chapped. They're just killing me. But I just felt like I couldn't bring myself to be like, and also, can you open the suitcase, and in that pocket, can you get my chapstick? And instead I was just like, I gotta let the poor guy sit down for like 2 minutes, because I knew he was tired too. So it kind of was one of those things where it was death by a million paper cuts, right? There was no one big thing, but in the intensity of the constant little things, it just wore us down. And honestly, I knew then, and I know now, that we were so lucky with our postpartum experience. I had not labored before my C-section, so I wasn't as physically exhausted as people are who go into the first C-section having worked hard in labor, or having gone into the C-section that way. I also had a completely normal, uncomplicated cesarean birth, and my recovery was right on track. But nonetheless, we found those early days to be quite intense, even as I regained my mobility. And so I think that was tricky, just because it changed so much about our relationship so quickly. And I think it's also tricky. Pain is so unique to each individual, that very early on, I was surprised that I had some breakthrough pain that also caught me off guard. Whereas a few days out, like by day 3, I was actually doing quite well with pain. But when you get that, when someone is in pain, it just makes it harder to deal with everything at the same time as well. So, yeah.
I think I want to bring up too that you mentioned in the other episode is that you were doing a lot of swimming and like 40 minutes in a pool going upside down. Like that's a lot of effort. So your core muscles were like, you had actually worked out a lot in your pregnancy too. So you didn't come into this without some good constitutional strength, in the first place. So I think there are people who say, oh, well, I'm in good shape, I'm not going to have that problem, when it's not really about that. You had major surgery.
Yeah, right. Exactly. Yeah, I had been an athlete. I had exercised. I had, and in some ways that almost made it harder. Like, I think now, the lifestyle, now I've got 2 little kids, we're expecting a third. I spend more time just kind of sitting around, you're like on the floor playing with kid toys or reading kid books. I've readjusted my whole lifestyle, but it was also a big adjustment to be like, wow, I sat in bed all day today. It just felt weird. Yeah.
Also, another point that's come up in other episodes is don't send your partner home. I see so many people are like, oh, the nurses are going to take care of me, so I'm going to send my partner home to sleep in their own bed. But the nurse cannot be in there doing those very necessary little things, like get my chapstick, prop this pillow, help me move this butt cheek 1 inch because I'm uncomfortable, because I can't do that for myself. And it is unnerving to be an independent person and have to ask for help. And you're going to need to ask for help whether you have a cesarean or a vaginal birth, right? If you push, a baby out of your vagina, your bottom's going to be really sore, So, so don't send your partner home, please. Don't expect that it's going to be exactly the same. It's just the baby's going to be on the outside. There is a recovery in the short term, in the long term, when you have to get a baby, a human, out of your body, so be kind to yourself. Thank you for saying that, because too often people send their partner home. And I just,
even after a vaginal birth, sometimes it's hard to move. And I don't,
Absolutely.
I would like people not to send their partner home or anybody, just have somebody with you in the room 100%, even if you have a vaginal birth, because now you've got an extra person to take care of. You just went through whatever birth process it was, even if it was vaginal, that can be a lot of work and you need that extra person there.
Yeah. And, you know, I think that's also important. Like maybe we should have asked the nurses to do a few more things for us or whatnot, but also, you know, at that point, you're pretty emotionally vulnerable, right? Most people arrive at birth pretty exhausted, but if by some miracle you're not, you're gonna be exhausted soon by the newborn. So you're gonna be exhausted and there'll be a big hormonal swing and you have this big role transition and you're figuring out this new baby. And it brings people to a very vulnerable point. And so it was just easier. I was, even though I didn't want to keep asking my husband these things, it was easier because I was comfortable with him and we had this intimate understanding and we were just, you know, working through it together. It was more comfortable, I guess, to just have someone that I knew and loved there. Yeah, that is a tricky thing right now with COVID-19. Families are stuck in a tricky spot. If you've got like a toddler at home, there's a tricky calculus there. Yeah.
Absolutely. Yeah. No, but remember that you're going to need that support. So maybe trying to really think hard about a plan B instead of just defaulting to, I'll just send my partner home with the toddler. If there's any possibility that you can get someone to take care of your other children, your pets, whatnot, you know, I as a nurse would strongly recommend that you look at every avenue before deciding to send your partner home. If there's any possibility someone else can help, because you are going to need that help, and you deserve it too. You deserve it. So we talked about the challenges. What of some of the positive experiences that you had during your cesarean birth? Was there anything, I guess let's start in the OR. Was there anything that you did in the operating room or right before surgery that helped it be a positive experience?
Yeah, there's lots of things that we can do to make it a more positive experience, and people are constantly coming up with new ideas. So it never hurts to sort of check the internet right before as well. I feel really lucky that I did have really amazing support. And that's why truly, you know, overall, it was a very positive experience. Right at the time of the birth, you can make it a very family-centered experience for you based on your own personal preferences. Most places allow you to have a support person come with you to the OR. So my husband was right next to me and I still felt like it was us together greeting our child. And that was important. I think, you know, sometimes a partner might say, like, well, I'm a little squeamish or something, or like, oh, maybe I'll see you in less than an hour. But it's a monumental moment. And it's a momentous moment. What am I trying to say? And it's special and fun to have at least one other person there with you. Let's see, I asked to have a clear surgical drape used so that I could look through the drape and I could see the baby being born. And so I will say my husband did get a little squeamish and he kind of knew ahead of time that he was not going to be looking at the surgery. He was just going to stay focused and look down at my face. But one of my coworkers got a really great photo of me through the clear drape of my daughter being born. And I got to kind of like, you know, look up and see her being born. Often if the baby is stable, you can still do delayed cord clamping, even with a cesarean birth. We didn't know if our baby was a boy or a girl, and the surgeons were quiet, and they let my husband and I look and see for ourselves. And I think that that's typically practiced, but I don't know. I mean, certainly at the hospital I work at, I'm not seeing providers announce the sex of the baby. But you know, check in with your providers ahead of time and just be like, you know, we'd like to look and we'd like to announce it if that is something you'd like to do. Let's see. Oh, I was wearing a hospital gown with snaps on the arms so that when my daughter was just a couple of minutes old and she'd been dried off, then the nurses placed her on my chest and piled some warm blankets on top of both of us. So I had near immediate skin to skin time with her. And that was probably the most special piece of it, is that I just felt like I was snuggled up with my baby and my husband, and we were just in our own little pod there. And it was, that was the time when the surgery was being finished. So if I had just been lying there in the cold OR staring at the ceiling, I think that those next, whatever it was, 40 minutes or approximately how, it would have been a long period. But instead, it was this really special time. And it was us just, like doing all the things that new parents do, like look at her fingers and just figure out little things about your baby. And my daughter even breastfed during that time. So, and I tell people, don't push it, don't force it. It's a very awkward position to be in. If the baby is not going to breastfeed, don't worry about it. They can still smell the nipple and lick the nipple and get well positioned to be ready to breastfeed when you are able to sit up shortly. But it was just a really special time. And then I think it's really important to just speak up about what you're feeling. So I was really lucky that I felt fine throughout my surgery, but if someone is feeling pain or nausea, or you feel claustrophobic or anxious or anything, it's important to just say so, and the earlier the better, so that the team can help improve it. And I think that that's something where, sometimes people are reluctant to say something because they're thinking like, well, maybe this is normal. But if anything else, there's always an anesthesiologist right near your head. So just saying something like, I'm starting to feel a little bit of pain, or I'm feeling a little nauseous, or whatever it is, can be really helpful for them to be able to get on top of it early. Yeah, there's lots of other things. And so like we didn't have any music playing in the OR. We just kind of didn't think of it, I guess, at the time. But like that's an option in a lot of places. Or, again, just speaking up about things like making sure that you feel a comfortable temperature, so that if you're cold, they can pile a lot of warm blankets on you, or maybe even raise the temperature of the room. If you want the lights a little dimmer, they can, because most places have a surgical light that will shine directly where the surgeons need to see. So where you are and where your baby is can be a little bit more dim often, depending on the facility. So just kind of speak up about what things feel like you'd like them tweaked.
And definitely advocate for yourself if this is something that you want. So, if you talk to your provider in the office about your cesarean birth wishes, and they say, oh, well, we don't do skin to skin in the OR, or, we don't allow, your partner in the OR or something like that, then, know that you are a consumer of healthcare and you can take your business elsewhere. That's always your choice. But what I also like to say is that sometimes we need to know ahead of time as the nursing staff. So as a labor and delivery nurse, if a parent wanted skin to skin in the operating room, we'd need to have a second nurse in there to help monitor the baby, while the circulating nurse could help monitor the surgery. And that was something that we generally could do, but we needed just a little bit of a heads up notice. So when you're getting prepped for surgery, talk to your nurse about what you would like, so that we can help make that happen. And then thirdly, for example, skin to skin in the OR, sometimes just because the mother or the birthing person is feeling really sick, or the baby just needed a little bit of extra help to get breathing and crying, the surgery is kind of over before there's an opportunity to do skin to skin. Mm-hmm. Don't worry, because as soon as you get that baby on your skin, whether it's 2 minutes later, 2 hours later, 2 days later, if your baby's in the NICU because they're sick, you're still going to get those benefits of those hormones and that skin to skin and being with your baby. Like I feel like sometimes people think, oh my God, it didn't happen right after birth, or it didn't happen, I didn't bring the baby up onto my chest like a vaginal delivery and therefore all is lost. But not all is lost. As soon as you get that baby on your chest, you're going to both benefit. And you can we hope you liberally hold your baby skin to skin, not just in a few hours after birth, but in the weeks and months after your baby is born. So don't worry if it doesn't happen right away. There's still plenty of opportunities that, we can help make that happen for you.
Yeah, excellent point. Yeah.
So do you think having a cesarean yourself has changed the way you counsel your patients who need a C-section, Kate?
It certainly wouldn't change when I recommend one, because, prior to having one, and then certainly after having one. Of course, if there's, an option for trying for a vaginal birth, then I'm, right there working as hard as I can with a family. But you mean maybe some of the like tips or something for recovery, or
yeah, and I'm sure you learned a lot, about just the recovery process of a cesarean. Is there anything that you recommend to that? How can they make it positive, not just in the OR, but kind of moving forward? Anything you help advocate for your patients?
Sure. So let's see here. Okay, so for most patients, certainly for many of the midwifery patients that we're seeing, if they have a cesarean, it's more often than not an unplanned cesarean. So I don't want someone to be focused on all of the things that could go wrong during their pregnancy, so that they're planning for all the contingencies, for all the worst case scenarios. I don't think that's a healthy way to approach labor and birth at all. But I think there are a few little things like, toss a couple of packs of gum into your labor bag when you pack it, because if you have a C-section and you chew gum frequently afterward, that helps a lot with pain. It reduces gas pain, and it also kicks your GI tract into gear sooner, so that you're just going to have less cramping, less bloating, and a more comfortable recovery. So that is such a benign intervention. Like early on, like when the baby is 1 or 2 hours old, have someone put a piece of gum in your mouth and just start chewing, and then try to chew 5 or 6 pieces of gum a day. But it's also tricky, if you have an unplanned cesarean in the middle of the night and you don't have any gum and the hospital gift shop is closed, and you're not gonna, I talked about how much you need your partner there. You're certainly not gonna send them down the street to go buy a pack of gum. That can be one really simple, just really useful intervention. And then I counsel people to, kind of get up out of bed as soon as possible. And that's a hard one, because, there is pain, and there is, and it's just hard. Your core muscles take a little while to come back, to say the least. But trying to get people up out of bed. One thing that's great is more and more places are doing a new protocol where it's called something like ERAC or ERAS, so Enhanced Recovery After Surgery. And so there's a new protocol for which pain meds are given. One of the big improvements is that it's decreasing the amount of opioids that are given, and they're focusing instead on using a lot more NSAIDs and things like simethicone and things like Miralax and Colace to help with keeping stools soft, and also promoting a lot of skin-to-skin time with the mother and baby. So lots of things to sort of help with the with other systems in the body, and ways that can help minimize post-op pain. Let's see. I was surprised for myself having a full bladder, not even a full bladder, having like a 1/3 full bladder, put a lot of pressure on the incision in the first few days. And that was probably the biggest thing I could do myself for my pain control in those early days. And so that's something that I am like always on with patients when I round postpartum, because after you have pregnancy and then birth of any type, it's pretty common to have a decreased sensation of when you have a full bladder. And I think you're also, you're busy with a lot of things with newborn care and maybe visitors coming in and out of your room. It's easy to lose track and to have your bladder really fill up without you realizing, like, oh my gosh, it's been 6 hours since I went to the bathroom. So it's not only important to be getting up out of bed frequently anyway to, to just stay mobile, but it's also important to keep your bladder empty. And I think that when I really encourage patients to just, even if you don't have any sensation, just look at the clock and think, like, has it been 2 or 3 hours since I've used the bathroom? Just go try to empty your bladder. Then I find that their pain control is better. So that was one of the big things that I learned from myself. And then I think you also can use really benign interventions like a heating pad on the incision. That can be very soothing and comforting. If you just have, like very, very mild pain or like a little bit of pain before, just shortly before your next dose of medication is due, you might be truly comfortable to just do something like empty your bladder and use a heating pad and then take your next scheduled dose rather than adding on an extra pain med. That being said, if a heating pad doesn't cover the pain, you should take the extra dose of pain med. It's definitely better to stay on top of the pain and a little bit ahead of it rather than playing catch up. You'll definitely end up taking a lot more pain med total if you're playing catch up. Another fun or another useful tip is to create some sort of splint. So something like a pillow or even just like a tightly folded towel or blanket, and use that against your incision. So if you need to cough or sneeze or laugh or do something that can be, you might be like generally pain-free until you have to sneeze, and then you have like a searing, shooting, excruciating pain at your incision. So if you can splint the incision and support it by just, it's tender, but you just take something and press very gently into the incision and then cough, it will feel so much better having that support there. And that's counterintuitive for a lot of people. But, yeah, I don't know. What other tips and tricks have you guys found?
That was a lot of good ones.
Yeah, no, I agree with all of them. And I double, triple want to drive home the keep on top of your pain, because you're going to take more pain medication and be more miserable if you play catch up than if you at least keep up with the ibuprofen and the Tylenol, right? So those are called adjuvant pain medications, meaning they work differently than opioids. And so if we can do like Tylenol 3 hours later, ibuprofen 3 hours later, Tylenol 3 hours later, ibuprofen, like tell your nurse, just bring them in when they're due. You are going to use less or no opioids than if you try to just, wait till you're in pain and then take pain medication. You're probably going to need the Tylenol, the ibuprofen, and the opioid, right? So sometimes the doctor, because it's just part of the order set, they order Tylenol and ibuprofen as what we call PRN or as needed medications. I would recommend as a nurse that you tell your nursing staff, just bring them in when they are due. That way it's one less thing you have to remember. And when you're home, even setting an alarm on your cell phone for, taking the ibuprofen and taking the Tylenol and snoozing it until you actually put those pills in your mouth instead of just like shutting the alarm off. I think that's important to do even with a vaginal delivery, to keep up with those types of pain medications, because there are too many people, especially after a cesarean, I found when I worked postpartum, that I'd ask them about their pain. They'd be like, oh, I'm fine as long as I don't move. And that's how you're going to get blood clots and pneumonia and end up back in the hospital with a wound infection, right? So we want you to, it's not going to be no pain. There's going to be discomfort recovering from major surgery, but you need to feel comfortable enough to get up and out of bed, to use the bathroom every couple of hours, to get up and out of bed and sit in a chair for meals, for example, to take a walk, around your room a couple times, or, down the hall, if it's, not COVID-19 restrictions. But basically, if you can't do those small things without significant pain, then you need to have a conversation with your nursing staff or your medical staff about changing up your pain regimen, because just staying still isn't what we want. We don't want you to only be in no pain when you're still. We need you to be comfortable enough to take care of yourself and your baby. So
some people some people will say they're trying to stay away from medications because I don't like to take medication, or I'm afraid that it's going to get to the baby. And it's very, very safe for breastfeeding. And it's more important for breastfeeding for you to cover your pain so that you can actually feed your baby frequently and be able to hold your baby comfortably. So I just encourage, it's not just pushing medications for your own pleasure so that you're comfortable. There's really good reasons to make sure that you're up with that, and there's no risk to the baby to take those.
Absolutely. And in fact, if you have uncovered pain, that can also impact whether or not your milk comes in, or at what quantity it comes in, or when it comes in. You want to just hopefully be as close to pain-free as possible. Yeah.
Right.
So are there any last thoughts that you have, Kate, about for anybody that's listening that might be looking to plan their own positive cesarean experience or be prepared to advocate for one in the event that they need one?
Let's see, I guess we touched on this a little bit, but I think, of course, it's important to just be flexible in what you're visualizing for your birth. You want to assume normalcy, but also allow room in your thinking for a change of plans. It was interesting for me because as a midwife, I had, of course, seen many people have to deal with the unexpected, and so it's a privilege. I've been able to witness people in these really vulnerable moments, as both of you have as well, when I've witnessed very effective coping strategies and then also ineffective strategies. And I've also helped a lot of people process their births and wrap their heads around unexpected changes. But, I think you have to constantly allow for flexible thinking, and that's just part of parenthood as well. And I remember feeling like I had already made so many adjustments. Like first she was breech and I was so focused on getting her to turn. And then I had reframed my thinking and I was all geared up for attempting a vaginal breech birth. And then I had readjusted for a cesarean. And, I think it's normal. It is normal in pregnancy to focus and think about the labor and birth. And it's important to do that normal mental work, but it's also sometimes tricky when there's a twisty path at the end. So you just want to make sure that you've got some rock solid coping strategies under your belt so that you're going to be able to deal with unexpected curveballs, and they're just going to keep coming once the kid is here. So they're just going to keep coming.
Amen to that. That is true.
Yeah. And then I guess, so I also would just mention with my second birth, I had a VBAC, which again, very personal decision without question. That was for my family. The recovery so much easier physically. But I really think the emotional side of it was a huge piece of it as well. After the VBAC, like on postpartum one day one, if I was thirsty, I would just lean over and reach for my water bottle and not even think about it. So I just felt more like myself. I felt more like a capable, independent person. My relationship with my husband felt closer to its normal side. And that's just how these things work, right? You don't recognize your advantages or your privileges until you don't have them. And then, I was just surprised by all those little trickle down effects. So, so I guess the other piece is if you have a C-section, I think it's worthwhile checking in with your providers to see if they think you are a good candidate. If you're planning another pregnancy, if they think you're a good candidate for a VBAC in the future. And there are many, many hospitals that do enable VBACs, vaginal birth after cesarean. And if it's the right decision for you and your family, it can be a much easier recovery. Yeah.
Yeah, you had mentioned you're pregnant with number 3, so you might have been looking at cesarean number 3 had you not had a VBAC. So I hope that you have another successful VBAC with this baby. And thank you for sharing your story with us today.
Thank you so much. And thank you to you both for this wonderful, wonderful work. And you're doing a great job. This was fun.
Thanks.
Thank you.
I really appreciate that you shared all that. I don't think every care provider is willing to share their own story so in detail. So I hope people are listening and finding some inspiration to do some of the same things that you did.
Thanks so much.
And we discussed last week all about vaginal birth after C-section. There's another episode where 3 people shared their experiences of making that decision about having a VBAC, and then they ultimately all had a successful VBAC. And the International Cesarean Awareness Network is a great resource, not only for VBAC, but also for pregnant people that are planning a cesarean and want to advocate for some of the things that Kate mentioned to have happen in their own birth. And I know from working with families over the years that it really is interesting when you talk to one care provider and they say, oh, we don't do that here. And I literally am like, no, I literally know somebody who just had a C-section at that hospital like that. But your OB doesn't happen to know that. But it did happen at your hospital. And then there's some hospitals that do it so routinely that everybody knows that it's a possibility to have some of those added special pieces of the operation like you did, Kate. So it's a good thing to get informed and push a little bit to find your needs met. Absolutely. So yeah, there we go. All right. Anything else? Oh, our next episode is Wednesday, May 20th at 5:30, and we'll be discussing pregnancy and parenting after age 40, where we'll be joined with two moms, one who had her first and only pregnancy at 40, and the other who had one baby at 30 and her other baby at 40. So that'll be interesting talking with them.
I'm excited for that episode. And like I always say, if you learned even one teeny morsel of helpful information today, don't be stingy, and please text a friend who is pregnant or parenting and tell them about our podcast and our video cast. And if you want to laugh your stretch pants off while learning about breastfeeding, childbirth, labor, babies, please consider taking a live and interactive Zoom class with us while quarantining. Virtual lactation consults and support groups are also available. Just check out the babiesincommon.com website for all of that information. And if you like Babies in Common on Facebook, we're always posting great articles, videos, and resources to help you rock your birth and thrive as a new parent. We are a community for you. After all, we all have babies in common. Yay! Thank you, Kate. I'm so appreciative of you being on today.
Oh, thank you guys so much.